nurse for today, and I'm going to perform a physical assessment on you head to toe. I just wanted to let you know that this is completely confidential and you can refuse anything at any time, okay? Alright, we're going to go ahead and get started with your head and your face, just inspecting your skin. There are no lesions, bruising, or burns. I'm also going to palpate your head and feel your cranium. There's no nodules or lumps. Also going to palpate your sinuses here. Do you feel any pain or pressure? Okay, very good. Now I'm going to palpate your temporal arteries, which is right here. And both of them are equal and palpable. I'm also going to feel your jawbone for TMJ. If you will, open, close, open, close. Good. Okay, I do feel a clicking in your left side here, but you have had oral surgery before, correct? Okay, very good. Now I'm going to test your fifth and your seventh cranial nerves. So if you will, smile for me, frown, clench your teeth, puff your cheeks, and close your eyes really tight. Okay, very good. Also raise your eyebrows. Good. Okay, now we're going to test your visual acuity. So if you will, come over here for me and stand on this line that marks 20 feet. And if you will, please read to me the lowest line of letters.
P, E, Z, O, L, C, F, T, and D.
Good. All right. Your vision is 20/20. Do you wear glasses or contacts?
No.
Okay. Good deal. All right. You can have a seat back on the table here. Okay. Now I'm going to also test you with my finger. You'll just follow my finger with your eyes and not your head. Okay. Okay, very good. Both of your pupils follow me equally, both eyes at the same time. Now I'm going to shine the light and check both pupils for reaction to light, okay? Okay. Alright, both of them are reactive to light. Both pupils are round and the sclera are white and there is no drainage. Your eyes look clear to me. Now we're going to test for accommodation. So when I tell you to look at the wall, look at the wall. And when I tell you to look at my finger, look at the finger, okay? Alright, ready? Wall, finger, wall, finger. Good. Your eyes dilated when you looked at the wall, and they constricted when you looked at my finger. Now we're going to just palpate around your eyes. Tell me if you feel any pain. Feel okay? Good. Next is your ears, and I'm just going to palpate and inspect your ears. There are no lesions or anything. Is there any tenderness or pain as I feel through here? Okay, and this one has no lesions. Next test is the whisper test, and when I whisper this word to you, I'll include the one ear and you tell me what I say, okay?
Key.
Car. Okay, very good. You passed that. Okay, next test is the Weber test. So I will put this tuning fork on the top of your head and you tell me if you can hear it with both of your ears, okay? Both of sides? Alright, good. Alright, next test is the Ryan test, and you tell me when you can't hear it anymore from the back of your head, and then I'll put it by your ear and tell me when you can't hear it anymore as well, okay?
Okay.
Alright, this side. Still hear it? Okay.
Alright.
Alright, tell me when you can't hear it anymore.
No.
Okay. And now we're going to do the other side.
Okay.
Alright.
Okay.
Alright. As you'll see, when it's in your ear and by your ear here, the air, you'll hear it twice as long as you would back here on the bone. Okay? Alright, now I'm just going to take a look at your nose and make sure, inspect it. There's no lesions, both sides are equal. and there is no drainage. You haven't had any drainage, have you? Okay, I'm just going to palpate your nose. Any pain or tenderness around here? Okay, good. Now I'm going to get you to occlude each nostril and sniff, okay? Any difficulties? Okay, very good. And now let's see. We're going to move on to your tongue. And I'll just look inside your mouth, so if you will stick your tongue out for me. Alright, your tongue looks good. It's pink and it's moist. There are no lesions and your membranes are pink and moist. Your gums look good. And I'm going to stick this tongue depressor here on your tongue. And you just say, ah. I'm going to look at your uvula, okay? Ready? Go. Ah. Okay. Looks very good. And, like I said, there's no bleeding, everything's intact, no lesions, anything like that. Alright, now we're going to move on to your neck. I'm just going to palpate your neck. You don't have any tenderness, do you, here in your neck? Okay, we're going to start with your lymph nodes. Back here is your post-auricular. Tell me if I hurt you at any time. The occipital. Okay, we're going to move up here to the submental. Any pain here? Submandibular. Alright, and then the superficial cervical, and the posterior cervical, and then the deep cervical. And then down here is the supraclavicular. No pain? Okay, now I'm going to check the range of motion of your neck, so put your chin to your chest. Okay, and then turn your face to each side. Good. And now your ears to each shoulder. Okay. Now I'm going to check your muscle strength, so if you will, push against my hand. Good. And again. And there was no pain doing any of that. Okay. Very good. You have good range of motion. Also, I'm going to get you to shrug your shoulders. Okay. And now do it against my hands. Any pain? Good. All right. Now I'm going to palpate your trachea and your thyroid, so I'm going to get you to slide around here. Good. Actually, if you will, slide this way so we can see you face this way. Good. Alright, I'm going to come behind you. And when I tell you to swallow, just swallow, okay? Alright, go ahead, swallow. Alright, your Adam's apple moved up and down. Any pain or difficulty swallowing? Alright, very good. Now I'm going to palpate your carotid pulses first. So if you will, just bear with me. Okay, this one is palpable and regular. Okay, this one is also palpable and regular. I'm going to listen to your carotid pulsars for a bruit here, which is what we don't want to hear, with my stethoscope, and the stethoscope does not have a bell. The bell's inside here, so I'll be using that. Alright, if you will, just breathe normal. Okay. Okay, everything sounds good there. Now, if you will, turn and face this way for me, and we're going to take a look at your back and listen to your breath sounds. I'm going to lift your shirt up here. And there's no lesions on the back. Contour's good. Everything is indeed symmetrical. And I'm going to listen to your breath sounds, okay? Alright, go ahead and take a deep breath. Okay, again. Okay, one more. Okay. Okay. Okay, all of your lobes of your lung are clear. You haven't had any problems breathing or anything? Okay, good. Now I'm going to percuss the back of your back here for any abnormal sounds. You'll just feel some light tapping. Tell me if you feel any pain at any point. I'm going to percuss the bottom of your back here. Tell me if I hurt you. Just looking for any pain, okay?
Nope.
Okay?
Nope.
Alright, good deal. Now, as I work my way down your back, I just want you to say the words 99. Ready? Go.
99.
Okay.
99.
Okay.
99. 99.
Alright, good. Equal vibrations on each side, okay? Alright, if you will turn back to the side here for me. We're going to look at your upper extremities. Okay? I'm just going to inspect and palpate. Tell me if you feel any pain going down your arm. Okay? Very good. I'm going to palpate each artery. Okay? Each pulse here. So I'm palpating the radial pulse. And it is palpable and regular. Palpating the ulna. It's palpable and regular. And your brachial. Palpable and regular. Over here on this side, your radial is palpable and regular. Your ulna, palpable, regular. Your brachial. Okay, both of those are palpable. I'm going to check for capillary refill. It's very brisk, less than 2 seconds on both sides. Okay. Now we're just going to check the range of motion in your arms, so if you will, up and then come behind, okay, and flex and extend, okay, now flex against me and extend against me. Good. Alright, also we're going to check the range of motion of your wrists, so just twist them around, come up, come down, okay, raise your hand, push your hands out, make a fist, come out like this and put your fingers together. Now touch each finger to your thumb. And then finger to nose. Very good. All right. Next is the fingers to the nose. We're checking the cerebral function, by the way. Now I'm going to check your sensory function. So I want you to close your eyes. I'm going to place an object in your hand and you tell me what it is, okay? All right. Go ahead, close.
Cotton ball.
All right. Good. And now the next object in this hand. Tell me what it is.
A key.
Okay. Very good. Now, I'm going to draw a letter or a number in your hand and you tell me what it is, okay?
7.
Good.
C.
Very good. All right. Perfect. Now, on to your reflexes, all right? So, first one is your radial here. Okay? And then the brachial, and just relax your arm, okay? Okay, and as you can see, your bicep here is flexing, and then it also makes your thumb move. And then coming right here, I'm going to check your triceps, so just let your arm hang. Good, all right. Now to this side, going to check the radial. Okay, and then the brachial as well. Just relax your arm. Good. All right, and now for the tibial. Okay, relax. Are you relaxed? Okay. Good. Perfect. All right, now let's see what's next. Okay, if you will. Lie back for me, and I'm just going to inspect your chest, and we're going to listen. Everything is good here. Your skin looks good on your chest, and there's no lesions. I'm going to just palpate the chest here for any pain. Your breathing, just take regular deep breaths, and you have symmetrical breathing that's deep. Inhale and exhale. All right, now I'm going to inspect. I don't see your PMI, which is good. I'm going to listen to your heart. I'm going to listen to the aortic, pulmonic, mitral, cuspid valves, and then we're going to make sure we hear the S1 and S2, okay? toes are able to be heard, and I do hear the S1 and S2. Now I'm going to also palpate and make sure there are no murmurs. Again, my stethoscope has the bell in here. Okay, there are no murmurs present, which is good. Alright, now for your abdomen, I'm going to lift your shirt up here and inspect it. There are no lesions. Everything looks good and symmetrical. Don't see any masses from here. I can also see where you're breathing in and out. Looking at your umbilicus, there's no hernias or contours. Now I'm going to listen to all 4 quadrants of your belly, okay? Okay, all 4 quadrants, I can hear your vowel sounds, they're good. Next, I'm going to listen to your renal arteries, okay? Okay. Your aorta. Okay, all of those are regular. You can hear those good. Now I'm just going to percuss your abdomen in all 4 quadrants here. Let me know if you feel any pain, okay? Okay, all that sounds good. Now I'm just going to lightly palpate your abdomen in all 4 quadrants, and I want you to tell me if you feel any pain. Okay, now a little deeper palpation. Tell me if you feel any pain or tenderness, okay? I'm also going to palpate for the liver here, and it is not palpable, which is a good thing. Okay, thank you. Alright, now you can go ahead and sit back up, and I'm going to actually lay back down. I'm sorry. We're going to check the range of motion of your legs. So go ahead and pull your knees to your chest, okay, and then extend them out, okay, and then come and roll your hips out if you can. Very good. And then straighten your legs out and kind of do scissors. Good. Any pain or problems with that? Okay. Now I'm going to check your range of motion of your ankles. So flex and extend. Good. Push against my hands. And then this way. Okay. And then slide each foot down each shin for this. Good. Very good. Alright, now you can sit up and slide a little. Perfect. Alright. Now I'm going to check for your reflexes, okay? Good. Good. Perfect. Okay, now I'm going to also feel the pulses in your leg, and I'm just going to palpate your lower extremities. Make sure I don't feel any nodules or lumps. Everything feel okay? Alright, good. I'm palpating your popliteal pulses. Okay, both of them are regular and palpable. Now for the dorsalis pedis, on the left side is regular and palpable, and the right side, regular and palpable, and then the posterior tibialis, okay, regular and palpable. Alright, now moving on. We are going to get you to stand up. We're almost done. And I'm going to get you to walk on your heels this way and then walk back on your toes. Okay? And back to me on your toes. Very good. Okay, now you can stand, hold your arms out to your side like this with your feet together and close your eyes. Okay? Good. Open. No sway, dizziness, feeling, anything like that. Alright, good. Now I'm just going to take a look at your spine and lift your shirt up. Okay? If you will, bend over for me. The spine is straight. And then touch your toes. Alright, very good. And then if you will, look at me and lean to each side. Any problems there? Okay, and then bend forward and lean back. Okay, all right. Well, our assessment is complete, and I thank you for your time.